Welcome to the MichCard Patient Management System, end-to-end technology solutions providing safe access to medicinal marijuana treatment in America. All registered doctors on the MichCard Patient Management System may access the doctor's portal by entering their user ID and password to sign in. A secondary login ID for administrators will be issued to doctors registered on the MichCard Patient Management System. Administrators will have limited access to patients' confidential medical records. All menu options can be found along the top and left panel of the dashboard for efficient site navigation. Upon logging in, the doctor will access the dashboard, which is equipped with functionality including scheduling appointments, adding and locating new and existing patients, viewing existing prescriptions and prescription history, viewing the licensed producers within the network, and contacting support for assistance. A log of recent patient activity and patient intake records are conveniently located on the dashboard to provide the doctor with a snapshot of valuable information in real time. The MichCard Patient Management System is designed to facilitate, support, and simplify the examination process for the doctor. A convenient feature on the patient registration form allows data to be propagated before the doctor begins the patient examination. The patient may either pre-register with their general information online or with a handheld device in the waiting room before seeing the doctor. A patient photo will be uploaded by a medical administrator on site during the doctor's visit. The patient chart displays an overview of the patient profile and unique MichCard ID number, along with a snapshot of the patient's activity history. Before administering a prescription for medicinal marijuana, the doctor must first perform a complete physical examination by clicking on the chart module. The doctor has access to all the data on the patient intake form, which was conveniently entered into the system before the patient's physical examination. This includes referral letters, past prescriptions, and any other medical documents the patient wishes to include with their profile registration. All other patient prescriptions are stored in the patient's chart file on the MichCard system. This allows the doctor to monitor their patient's progress and garner feedback during treatment. The MichCard system's examination module mimics a standard protocol for admitting a patient into emergency care in North America. During a patient's first visit to a MichCard clinic, the doctor will initiate a patient evaluation that is similar to a standard method used in emergency care known as SOAP notes. The MichCard system allows the doctor to evaluate and document all pertinent information to assess whether a patient is a candidate for medicinal marijuana treatment. The comprehensive examination module allows the doctor to record the patient's vital signs and overall status of health during the time of their visit. Once the doctor has assessed that the patient is a suitable candidate for medicinal marijuana treatment, a recommended goal plan is formulated and documented into the system to track, monitor, and support the patient's progress. Officially documenting a doctor's protocol and activity while admitting a patient protects the doctor's license to practice in the event of an investigation by authorities. On the other hand, the system is also designed to protect the patient as it requires the practitioner to be thorough in the examination process necessary to qualify a candidate for medicinal marijuana treatment. The MichCard system is equipped with an intelligently built search query which allows doctors to locate a patient's ICD code. In healthcare, ICD codes are used to identify and classify diseases, disorders, symptoms, poisonings, adverse effects of drugs and chemicals, and injuries. To conduct an ICD code search, the doctor simply enters the first few letters of a condition, and the system's autocomplete function does the rest. The doctor can easily select the ICD code from a provided list, which will automatically add the code to the patient's profile. It is possible for a patient to have more than one ICD code registered in their medical records concurrently. However, it is mandatory for a patient to have at least one code registered to their MichCard patient profile in order for the prescription to be valid. After documenting the ICD codes, the doctor will click Save and Continue to store the initial portion of the medical examination. A list of any and all prior examinations for the patient is displayed below the examination module. By clicking on the Exam Complete button, the doctor can move on to the next step of generating a medicinal marijuana prescription. The Add Prescription module allows the doctor to educate the patient about the prescribed medication, recommend a dosage, adjust the prescription date and duration, and inform the patient about licensed producers in their area. The prescription module conveniently allows the doctor to manually add further instructions or notes pertaining to the patient's prescription and also displays the patient's prescription history. From here, the doctor will click the Save button to complete the module. After updating the patient prescription files, the doctor is now able to administer a temporary MichCard. A temporary MichCard will be issued to the patient immediately after the examination, while the permanent card will arrive in the mail within 7 business days. For identification purposes, a photograph of the patient will appear on both the temporary and the permanent MichCard. However, to protect the patient's privacy, no confidential medical information will be stored directly on the card. At this point, the patient registration is complete and the patient is given secure access to the patient portal so they can begin purchasing their medication online.